Over to you, team.
Thank you, Shashidhar ji. Good evening, doctors, and good evening, team members. First of all, I take this opportunity to welcome you all on behalf of Hetero Healthcare. My name is Sachidanand Yadav. I'm Divisional Sales Manager for Helion Division, and I'm taking care of North. Thanking you once again all for joining us today to discuss the understanding of the role of nicotine replacement therapy in neuropsychiatric illness. As you all know about Hetero Healthcare, we are the largest R&D wings with having 360 solution provider. More than 25 years of excellence in multiple therapies. Currently, we are present in more than 126 plus countries worldwide. We are having more than 200 products across various therapeutic categories such as HIV, AIDS, oncology, cardiovascular, and neurology. Proudly, we can say we are having 4 biosimilar products to the market, and we are having manufacturing facilities in more than 36 plus states. We are pioneering in quality and innovation. Today, we have Dr. Palak Khemka ma'am. So, ma'am has done her MBBS from Regional Institute of Medical Sciences, Imphal, and she has completed her MD Psychiatry from Andhra Medical College, Vizag. When we talk about ma'am's achievements, she has currently lifetime membership of Indian Psychiatric Society. Also, she has won second prize in elocution in National Mental Health Week in Vizag year 2023. Ma'am have also presented paper in 55th annual conference of IPS held in Kerala 2022. Now, I request you to please share your experience to discuss more on subject. Over to you, Palak ma'am.
Good evening, everyone.
Dr. Ambush, if you can mute, please.
Good evening, everyone. So, I'm Dr. Palak Khemka, completed my MD Psychiatry from Government Hospital for Mental Care, Andhra Medical College, Visakhapatnam. So, as we all know that nicotine in any form, be in cigarette smoking, tobacco chewing, or smokeless cigarettes, is one of the leading health problem in entire nation, even though it is a illicit drug. As nicotine-related behavioral problems are negligible and relatively socially accepted form of substance use, its use is not considered as a problem by user or their relatives until it becomes a serious issue. So awareness is very much needed to check the global problem at hand. The slide is so according to WHO 2023 report, 28.6% of the adult actively consumes tobacco either in the smoke or smokeless form, and nearly 1.35 million deaths occur every year. Now coming to the background of addiction, nicotine causes dopamine release in nucleus accumbens by binding to alpha-4 beta-2 postsynaptic nicotinic receptors on dopaminic neurons in ventral tegmental area. It also desensitizes the receptor in GABA interneurons in ventral tegmental area, leading to decreased GABA neurotransmission, which decreases the inhibition of reward pathway, and it also binds to alpha-7 presynaptic nicotinic receptors on glutamate receptor on ventral tegmental area. All this mechanism ultimately leads to increased dopamine in the reward pathway of brain, which is responsible for reinforcing behavioral changes and dependence of nicotine. So, when there is a frequent exposure of any substance of abuse, so there will be leading to alteration of neurons at cellular and molecular levels, resulting in physiological alteration and associated behavioral related to addiction that results into tolerance, sensitization, dependence, withdrawal, and craving, and stress-induced relapses occurs. So, when an individual starts the nicotine use in any form, its acute use gives them improved learning, improved reaction time, better problem solving ability. It lifts the mood, decreases tension, lessen depressive feeling, better sleep quality, among many other positive reinforcement. Short-term uses of nicotine increases cerebral blood flow without changing oxygen consumption. Because of this, slowly an individual increases the use of nicotine as they stop feeling the same reward at previous dose due to shift of reward center from ventral striatum to dorsal striatum, And now is the problem for individual as small amount of decrease in the regular use leads to withdrawal effects like intense craving, restlessness, tension, irritability, drowsiness. Now the person is drowsy all the time in withdrawal state, but they have problem in sleeping, which is known as paradoxical trouble sleeping. They have depressed mood. There can be impairment in concentration and in appetite can be increased, which lead to negative reinforcement and relapses occurs because of all these things. So prolonged exposure to nicotine can cause desensitization and upregulation of the nicotinic receptors, leading to tolerance. We have like it has already been established that there are almost 70 carcinogenic activities or the compounds present in like cigarette smoking, and there are total number of 7,357 chemical compounds which is inhaled by a person during the cigarette smoking, which can cause cancer in almost every part of the body, can derange the mental health of the person, the person is prone to have heart attacks or heart disease, can have stroke, can have psoriasis risk, can have metabolic disorders like type 2 diabetes mellitus, hypertension, etc. They have like female using nicotine in any form can have fertility issues. There can be vision change or loss. There can be gum related disorders and irreversible lung damage. As we all know, the person can have COPDs and which can be the cause of death in lots of patients. So, smoking induces alteration in the brain structure and neuronal activity, which are linked to an increased susceptibility to neuropsychiatric disorder. So, what happens is there are lots of toxins in cigarette smoking, like transitional metals, reactive aldehydes, solid particulate matters, which leads to microglial activation, which can lead to cerebral oxidative stress and damage that can disrupt the blood-brain barrier, dysregulates the neuronal transmission, and ultimately lead to neuron damage and loss, which can lead to a lot of psychiatric problem. That is, it can lead to depression, anxiety. It can precipitate schizophrenia or any kind of psychosis, or it can be the maintaining factor in lots of psychiatric disorder. There can be neurodegenerative disorders like Parkinson disease. There can be neurocognitive disorders. Suicidal behavior can be seen, and it can worsen the ADHD also. So, as we have seen that oxidative stress, which can come from both free radicals in smoke or from oxidative imbalance in the cells, as well as inflammation, constitute a central shared pathophysiological pathway. So, tobacco smoking is not only implicated in neuropsychiatric disease through oxidative stress and inflammation, but also through direct exposure of toxin present in tobacco smoke. This smoke toxin lead to neuroinflammation and cerebral oxidative stress by microglial activation and can lead to amyloid deposition and neuronal damage and loss. So, a study published in International Journal of Molecular Science revealed that majority of the study population with individual having 3 or more mental illnesses were smokers. That is 61.4% of the study population were smoker and 21.9% of the populations were former smoker. That is, they have quit the smoking at the time of participation into the study. We have also come across the scenario where individual with the onset of mental illness start the substance use to have a better control over their symptoms. So now coming to the topic proper, let's discuss various ways in which nicotine withdrawal and de-addiction can be done. So as we know, there is no drug of choice or pharmacological management for nicotine withdrawal, which usually starts within 2 hours of the last smoked cigarette, which peaks in 24 to 48 hours and can last for weeks to months. Various coping strategies can be opted for symptomatic management like relaxation technique, yoga, drinking water, or doing the craving management, but people usually fails. So de-addiction can be done by nicotine replacement therapy, principle of which is nicotine absorption is slow when it is given in the form of replacement in the body compared to the tobacco, which reduce the chance of addiction. It provides the body with a safer alternate method, and it temporarily replaces much of the nicotine from tobacco, reducing the urge, eases transition from regular smoking to complete abstinence. So, NRT supply nicotine without the hundred of harmful chemicals that cigarette smoking contains. Most people get enough nicotine from NRT to avoid having overwhelming craving and withdrawal symptoms. It potentially downregulates the receptor over the time. You can gradually decrease the amount of nicotine that you get from NRT over several weeks. So, what happens is slower release nicotine delivery mechanisms such as patches are less enforcing because what happens is the resensitization of nicotinic acetylcholine receptor occur at very slow rate. The user has less control in titrating the dose of receiving a reward effect when desired. So what happens when the person is not having the same desire when they are taking the nicotine in any form of nicotine like cigarettes, tobacco, or e-cigarettes or whatever. So whenever they are not feeling the same effect, they increases the dose by themselves. But when we are replacing the nicotine outside, so they don't have that power to increase the nicotine by themselves. So because of that, there will be chances of getting this tea addiction properly. NRT assists with smoking cessation as they stabilize nicotine level in the blood, thereby reducing both the positive reinforcement and negative reinforcing effects. Also, NRT products contain lower nicotine level than the average cigarettes, and their impact on the body is more gradual. So, nicotine replacement therapy can be done in 5 ways. That is, we have nicotine gums, we have nicotine patches, we have lozenges or pastilles, which is available in some places in India. We have nasal spray and inhalers, which are not available in India. So, previously, nicotine patches were available as 16 hours, no tapered preparation, and 24 hours tapered preparation in three strength. That is 21 milligram, 14 milligram, and 7 milligram. So, as we know, according to IPS guidelines, what happens is if the person is using more than 10 cigarettes per day, the patch has to be used of 21 milligram and 14 milligram when the person is using less than 10 cigarettes per day. So, what happens is compliance with the patch is better. As it is simple to use, the patient simply places the patch on the body in the morning rather than actively using a product throughout the day, as we see in nicotine gums. Its slow, sustained nicotine delivery is there, provide nicotine in a steady state, and it has better compliance compared to other form of NRTs. So now, as we can see that there is not 16 hours or 24 hours. Now we have a 3-day patch, which is available. So what happens is it becomes more convenient for the person to use. They don't have to change every day. They don't have to worry about the patch. So they can just continue that patch for 3 days like straight away. The simplicity of the dosing regimen can improve patient adherence, and the continuous release maintains steady state concentration in the bloodstream. So, what happens in gum? Gum requires continuous effort. You have to keep on chewing the gum. You have to keep on packing it whenever you have that bitter taste in your mouth. And you are not doing it properly, you are prone to have the relapse again. There might be issue with the denture. There might be mouth soreness, hiccups, dyspepsia, jaw ache can happen because of continuous chewing. Bad taste can be there, and problem with pack and chew method is always there. Lozenges can cause hiccups, nausea, heartburns. Easy to misuse lozenges are there as similar to the sweets. So patches are much better in the terms of compliance of having better NRTs. Now we are coming to a study where it was done by Michael C. et al. That is the effectiveness of nicotine patch for smoking cessation, where it was double-blind, placebo-controlled nicotine patch study for 4 weeks or longer. They recruited for like 17 studies across, and the sample size was 5,098. What they found was abstinence rate was overall better in active patch user, that was 27% at the end of treatment and 22% at the end of 6 months. So they concluded that the nicotine patch is an effective aid to quitting smoking across different patch using strategies. Active patch subjects were more than twice as likely to quit smoking as individual wearing a placebo patch. Coming to a second study, which was done by Utkal Keshri Mohanty et al., which is on like it is a comparison study with they have compared nicotine replacement therapy and behavioral intervention. So the study was done across a year of 1.5 years. It was open label, 3-arm, parallel group randomized controlled trial with sample size of 130 people. So they compared the effectiveness of combining behavioral intervention and NRT with behavioral intervention alone in form of like the person who is smoking cigarettes or smokeless tobacco if they are using it. So at the end of 26 weeks, what they have found is 63.3% in behavioral intervention plus patch and 52.9% in behavioral intervention plus gum achieved abstinence compared to 24.1% who were there in only behavioral intervention group. So abstinence was achieved in 70.59% with patch and BI and 53 like almost 54% with BI plus gums versus only 28% in BI alone. So BI plus patch combination is more effective than behavioral intervention plus gum or behavioral intervention alone. Now, change in mental health after smoking cessation, a systematic review and meta-analysis was done. They took 26 studies that assess mental health. So the person who were having mental health issues and they were using smoking, they were included in the study. What they found is anxiety, depression, mixed anxiety and depression, and stress significantly decreased between baseline and follow-up in quitter compared with continuing smokers. So, what the conclusion was is smoking cessation is associated with reduced depression, anxiety, stress, and improved positive mood and quality of life compared with continuously smoking persons. Now, transdermal nicotine and psychiatric improvement. So, in some studies, they have found that in adult smoker with ADHD, transdermal nicotine alone or in combination with stimulant medication reduces difficulty concentrating, which is a core ADHD symptom. In another study, application of nicotine patch in smokers who are heavy drinkers resulted in consumption of fewer drinks and longer latency to start drinking compared to those not receiving nicotine patches. Now, how to use this patch? The patch has to be applied on a dry area, non-hairy. It has to be cleaned properly and it has to be dried. So, like the region like deltoid of the arm or below the nape of the neck is preferred. So, if the person is smoking more than 10 cigarettes per day, 21 mg patch has to be started for first to sixth week. Then the person can be tapered down to 14 milligram patch for 7th to ninth week, and the person can come down to 7 milligram patch for 10 to 12 weeks, and it can be stopped. It should not be stopped abruptly. Less than 10 cigarettes per day individual can be started on 14 milligram patch for first 6 weeks, and then 7 milligram patch can be continued up to 12th week. Side effects, if we talk about the patches, always there can be rashes at the site of application. So they may experience like nausea can be there, dizziness can be there, nervousness can be there, headache or irritability can be there. At the site of application, skin irritation or discoloration can happen. So if any kind of discoloration or rash is present, the site can be interchanged. And if the rashes is not going away in 4 days, the person should consult the doctor immediately. Now, as we see in Indian setting, not just cigarette smoking is there, lots of other form of tobacco consumption is there in the form of pan parag, gutka or e-cigarettes, for which not any kind of paper or research properly has been done, what has to be used as a nicotine replacement therapy and what are the guidelines. So what we can do is the amount of nicotine which is delivered by this method is not known by anyone. So better to use a 14 milligram patch in this people and monitor the side effect that they are having and continue as same like how we are using in less than 10 cigarettes per day people. Thank you.
Yeah, ma'am. Thank you so much, ma'am. Uh, so it was really nice that you have given all the insights. Ma'am, we do really have some questions, okay, from the audience. Uh, so the first question is came from Dr. Anuj that, just a minute. Yeah. So, ma'am, there are a few questions which been asked from our audience. So, one by one, I will post in this meeting. Okay.
Sure.
So, ma'am, the first question been asked, that is, any combination is required along with NRT for better result?
Okay, so regarding this, some studies are there where can use varenicline along with patch for a better result. So varenicline uses like you can set a quitting date, and 7 days before that you can start, and person can keep on using the patch or any kind of nicotine replacement therapy, and results are better. But it has not been studied or published very properly. But according to evidence-based medicine, we can go for that. So results can be promising with the combination therapy or any kind of behavioral intervention if you are going for, like motivational enhancement therapy. You can use it here. Motivational interviewing you can use, or CBT, or any like strengthening the coping mechanism and everything. It can definitely help the person quit the this nicotine better.
Okay. Thank you, ma'am. The second question is, ma'am, any potential side effects has been seen while using patches?
The potential side effects is always the rashes that comes first. Like, okay, they start complaining that it is itching or it is painful at that site, or just a few hours of using the patch, they can experience the nausea or vomiting. They might feel dizziness, but it is very minimal. It can go away with time, but the main concern always comes with the rashes, which comes with the patch. So you have to be very careful with this side effect.
Okay. Uh, One more question is there. I think you already have briefed in your slides. Can you suggest the nicotine patch dosing once again, ma'am?
Sure. According to IPS guidelines, if the person is smoking 10 cigarettes or more per day, you have to start the person on 21 milligram patch. And the patch has to be continued for first 6 weeks. And then you taper the dose from 21 to 14 milligram. You give it for 3 more weeks, that is seventh, eighth, and ninth week. And on 10th week, you will taper the person to 7th milligram, and 7 milligram will continue till 12th week, and then you can stop. So entire NRT goes for 12 weeks, be it any form. It is in the form of gums, patches, lozenges, whatever it is, the NRT has to be done for 12 weeks. So if the person is consuming less than 10 cigarettes per day, you have to start the person on 14 milligram patch from for first 6 weeks, and then you lower the dose to 7 milligram till 12th week, and then you can stop it.
All right. Ma'am, here one more question came. In case of alcohol addiction, will it work when combining with naltrexone?
uh, I haven't done like nicotine de-addiction में naltrexone usually I haven't used, so I don't know the result, and I haven't read more article on this one, so I won't be able to answer this. I'm sorry. So, like,
Yeah.
it might give promising result, but you have to go through it.
Okay, wonderful. Uh, One more question from the audience. What is the improvement in psychiatric disease outcomes you have observed in your clinical practice in patients who have been prescribed transdermal nicotine patch?
So, first thing that I have observed is the confidence. Like, they were able to stop the nicotine use. So what it was helping was it was boosting the confidence. So depression part and anxiety part of the person was overcoming. That I have seen on lots of cases. After that, what is happening is the person were able to do more work. They were gaining respect in the society or in the eyes of their family member, which was positive reinforcement for them. So in case of depression and anxiety, I have seen improvement just along like using antidepressants or anxiolytics along with this nicotine patch. I got better results in psychiatric illness outcome also.
Wonderful, ma'am. One more question been asked. That is, which form of NRT is better in chronic illnesses, ma'am?
In terms of compliance, patches are always better because
Okay.
the person doesn't have to have the hassle of using it continuously and going through it. But if you're talking about India, always patches is better. But if you're talking outside, there is the option of inhaler also, which give mouth satisfaction. So people prefer that over patches in outside India. That is there. But in India, always it is patches are better.
Patches are always better.
Yeah.
Okay. Ma'am, the one more question is that is NRT safe in people who still smoke? Okay,
Yeah, it
means
is safe.
along with the patches, I think they still keep on
Hmm.
smoking.
If they are still smoking and they are using the patch, it is still safe. But if the person is not able to quit even after 2 to 4 weeks of using the patch, you should stop the use of patch because there is no use. They are just using it it is rendered useless. That's why you should stop it, but there is no side effect.
Okay. Nicotine overdose chances.
Nicotine overdose chances are very less because nicotine toxicity occurs when you are taking almost a lot of nicotine, which is nearly impossible. But if nicotine overdose chance is there, symptoms will be like there will be nausea, vomiting, it will start from there, and there will be
Okay.
inability to concentrate, there can be confusion, there can be decrease in REM sleep, and there will be sensory disturbances. Then you can suspect it. But the chances of overdose, till now, I haven't seen, I haven't heard from my seniors also. So it's very less, I think.
Okay. But there are question. Okay, ma'am. One more question been asked. But before with this question, even my question was also there. That what if a person smokes and he still applies the patches, and as you said, ma'am, it will there is not going to make any big difference. Okay, so person should not use. But if he still continued using it, will there would be a chance of nicotine toxicity in the body?
No, no.
No.
It won't because the either that nicotinic receptor we are talking about, nicotinic acetylcholine receptors. So either it is occupied by the cigarettes you are smoking, or it is occupied by the patch you are applying. So basically, the free floating nicotine which is there in your body, that is going to be filtered out. It is not going to cause the toxicity in the person per se, but that small amount, as we are talking that nicotine patch already is providing less amount of nicotine from the normal form of smoking, so it is not going to cause the toxicity when it is combined with cigarette smoking and patch use.
Okay, great. One more question, ma'am, been asked from the audience. What is your experience of NRT in smokeless tobacco users?
I don't have any experience till now, so I won't be able
Actually,
to answer this one.
the ma'am really very questions been asked every time and everywhere actually because the chances.
That is the thing, but smokeless user are still less in our country. That what I can be higher socioeconomic status people are using it, or it can be seen now in adolescent people, like who are
Okay,
college goers and they are living in hostels and everywhere, who are not coming basically for this. As I have talked in starting, that smoking or tobacco consumption as per is not a problem for people unless it is combined with any other problem. So till
okay,
now I haven't got a case where a person is using e-cigarettes or something. So
okay.
I'll be looking forward to use NRT in those people.
In those cases also. Okay, fine. So I think this was were only the questions from the audience, and so far I think there is no such question. Let me check, ma'am.
Sure.
Yeah, ma'am. So we don't have any much questions from the audience. So this was really very, very insightful information which you have given, ma'am. and this is really going to help us a lot. Means to the people who joined as a participants, even for us, and because when we are also very well understood this concept, we can also tell to the team, and they can also deliver to other parts of region where this our people are meeting to the new doctors. So because of this insight, this is really going to be helpful for all the new doctors who is practicing or who wanted to prescribe this nicotine patches. So
I like
thank
to
you.
thank all the people who joined, taking your time out and listening out to me. Thank you so much. I really appreciate that, and I'm really honored. Thank you so much.
Thank you, ma'am.
Thank you.
Thank you so much, ma'am. Thank you, doctors, for joining. Thank you, IT
Thanks, sir.
team members, for conducting this smoothly. Thank you, Nileshji, and thank you, team.
Yes. Thank you. Welcome. And thank you from my side also, ma'am, who
Thank
given
you so
such a
much, ma'am.
beautiful
Thank you
session.
so much, ma'am.
Yes. And thank you, our IT team. Okay. So, Mr. Shashidhar,